Well, that goes on your head. So cephaly goes across the forehead.
Right. Can you talk a little bit about that too?
I don't believe it's FDA approved for children, or adult adolescents. I believe it is only approved for adults. That actually is the same kind of thing, acute rescue treatment when you get it, but it works very differently because it's actually doing electrical stimulation to frontalis, which is a different type of. This is a peripheral stimulation, so the goal would be like peripheral neuromodulation.
Slightly different method of action.
Correct.
Right. And then there's a VEP to HICP. This is not pronounceable. VYEPTIHCP.
Vyepti?
Is that how you say it? Go ahead.
Vyepti is actually a medicine. It's an infusion. It's an IV infusion for the prevention of migraine. So it really isn't isn't really related to it. Yeah.
Right. Okay. Anyway, there's a lot of work going on in this space. So anything else you want to say about work going on in this space? Because our audience is mostly people with complicated medical conditions and disabilities. So lots of people with migraines for a whole bunch of different reasons, or headache kind of syndromes. And maybe you want to talk a little bit about the difference between a migraine and an ordinary headache, and
absolutely
when you would want this and when you wouldn't.
Okay.
So that'd be great. Thank you. Anything else, Robin?
Just as a question, Jen, do your kids use this?
Yes. The girls have used it. I've used it. I have one in the office. I have this one I hadn't opened yet, but there's another one that is a model just to show people. I have a lot of patients that actually use it. Adolescents, we're part of the adolescent trial. So we helped to put adolescent patients into the trial. So I do adult and pediatric headache medicine. And so it's always nice for me because there really aren't a lot of things that are FDA approved for children, or adolescents. There's hardly anything, to be honest with you. And so it's really, really welcoming to have something go through that research process, that rigorous research process to be approved and to have that support.
Super. Thank you.
Does it work better if you can do other things like be in a dark room?
I mean, I think it's person dependent. So sometimes, like I have migraine too, which is why I kind of went into this. Is I had my first migraine when I was a fellow, or a resident actually, and I think that some people, it depends on the severity of the migraine at that day. So sometimes you can muscle through it and you can get through it. And sometimes you pay for it if you do that without treating in the upfront, if you don't treat at the onset of the headache. And then there's some people that, and there's some days, like I know that I'll have a headache the moment I wake up. I'm like, this is not going to be a good day. I got to do something right now or else this day is going to get away from me. There's other days that I'm like, okay, this is annoying. Maybe I have to eat some breakfast, maybe I got to drink some more water, and I can kind of work through it and then distract myself and then it goes away. But more often than not, someone who's had migraine for a long period of time will be able to know if that day is going to go south or not.
Hello, this is Joyce Graff. I'm with The Powerful Patient, and we're here today to talk about migraines. And first of all, let me introduce my colleague, Robin Martinez. Hi, Robin. How are you doing?
Hi, Joyce. It's wonderful to be here.
Thank you. Robin's out in Denver, and she is, as you know, the lead moderator for smartpatients.com. And we have an expert with us today, Dr. Jennifer McVige, who is an expert in neuroimaging, pediatric neurology, and working with concussions. So welcome, Dr. McVige.
Thank you for having me today.
Great. So tell us a little bit about you and your practice and how you got interested in working with migraines.
So I am at Dent Neurological Institute in Buffalo, New York. We are a private institute made up of about 20 neurologists and then several nurse practitioners and PAs. And we specialize predominantly in neurology. We do have psychiatry and pain management as well. I am a headache specialist, so I'm board certified in headache medicine, neuroimaging, as well as pediatric pediatric neurology in general, so all pediatric neurology, but I've gravitated towards headache and concussion. I run our concussion center predominantly because I struggle with migraines myself. And so as a resident, had my very first migraine while I was at the VA hospital and ended up throwing up in a garbage can and was mortified and went to the ER for treatment, and people were very confused by why the resident was downstairs needing help in the ER. And I'm like, because you have to treat me, and I'm telling them what to do, and they're like, we can't do that, and we need someone else to supervise you because you're the patient. And it was just very awkward, and it really was a pivotal point in my life where I realized that I knew the care that I needed at that moment in time for an acute rescue, and I couldn't even get it. That they were even trying to give me other things like strong pain narcotic medications and things, and I was saying no. I know that this is what I need, and so it made me realize that there's a great need in society for assistance with migraine and headache, and it's so prevalent. 39 million people living with migraine, and so I felt like this was my calling.
What's the difference between a migraine and an ordinary headache? I mean, all of us get headaches from time to time, but these are more severe.
So, a patient who has migraine headaches can have regular headaches as well. The interesting part is I get a lot of patients that coming to me saying, oh, I have the sinus headache. And I'm like, there's a study that was really well done by a group of ENT people that found that it was about 96, 98% of the time, patients that thought they had sinus headache actually had a different diagnosis. And some of them were quite serious. Many of them were migraine. So the interesting thing is a headache, most people can have a headache at any point in their life. Migraine is something that is more of a moderate to severe pain. In adults, it's usually unilateral, whereas in pediatric patients, it's bilateral. It's usually a pulsating quality. And it is characterized by somebody who most likely will have light and or sound sensitivity. They can have nausea and possibly vomiting. In fact, pediatric patients actually have vomiting more often than adult patients do, but you don't have to vomit to have a migraine. And in the beginning of a migraine, it can go on for several days, from up to 4 to 72 hours. So in the beginning of it, it can be very mild and then evolve into something that could be quite disabling. And so in the beginning, if you treat it right away, sometimes you can fend it off. But if you wait and you let it go for like day 2 and day 3, it can be very, very bad and go into status migrainosus and become very disabling.
So being able to treat it on the spot as you feel it developing is a big advantage.
It's important. Yeah.
So I understand that you and your daughters were participating in a study to figure out ways to deal with this without medication.
Yeah, so both my daughters, my two daughters and I, my daughter's 12 and 15, and we all three have migraine. We do know that there is a genetic component to this, and this is a disease state. And so unfortunately I pass it on to my children. I've reminded of that when they get it. Thanks, Mom. But it is what it is, but my daughters and I were not necessarily in the study, but I did help with the pediatric study for a device called Nurivio. This is a wearable smartphone controlled device. It is something that when someone it's an acute rescue therapy. And thankfully, it is one of the first drug-free therapies FDA cleared for the acute treatment of migraine in adolescents. And we don't have a lot to offer our adolescent population as far as FDA approved types of items. So it's nice to have that. But in the study, what we were looking for was patients to have a acute event, and what they would do is they put this on their upper arm, and you put it on for 45 minutes at the onset of the headache. In the study, the patients had to wait till they had moderate to severe intensity of their headache, and then put the device on for 45 minutes. It's a non-invasive neuromodulation device. And so what it does is it kind of modulates our pain response peripherally so that it de-escalates the intracranial pain response to the migraine. And it was shown to be quite effective for this adolescent population, as well. It is already FDA cleared for adults. So it's been FDA cleared for adults we just went back and looked at the pediatric population and looked at adolescents in particular, so 12 to 18 years old.
It's something that looks like an armband when you put it on. So and
Correct.
it's pretty low profile. So it's something you're intended to wear on your skin under your sleeve, right?
Correct. So you can put it on and put a sweatshirt over it or something over it, and no one will ever know that you have it on. You can go about your business. You can, I always make the joke, you can do your homework, and my daughter's like, what? You can do whatever you're doing. You can cook, you can move around, you can go to work. Nobody really knows that it's there. You would have your smartphone pre-programmed. When you get the migraine, you put it on. You click into the application, it immediately sets it up for you, turns it on. It feels just kind of like a tickle or a stimulation on your upper arm. You actually modulate it initially when you first set up the device for your preferential comfort level as far as achieving appropriate success with, it has to be helpful to be a stimulating feeling, but not uncomfortable to the point where you can't tolerate it. So you would turn it up until you can tolerate it, and then you like you would a TENS unit, and then you just hold it there. So it's already pre-programmed. You just put it on, put your shirt over it, do whatever you're doing for 45 minutes, and go about your business.
It does a sort of buzzing like a TENS unit, and you can dial it up or down depending on where you're most comfortable or where it seems most helpful.
When you first set up the device, you would initiate it that way, and then we would just leave it where that is, so that it would be adequate treatment for you each time you use the device. But you would feel it out the first time you put it on.
So is this basically a TENS unit, or is there some other distinction that you would draw? I saw the promotional video where it seemed like it was trying to stimulate a particular neural pathway that goes up and talks to your brain, so to speak.
Correct. So because it is a neuromodulatory device, and it is not, the intent is not a TENS unit. This is not intended to, relax your arm muscle. This induced a conditioned pain modulation response. So it's this global endogenous analgesic mechanism. So like this pain mechanism that will kind of ramp down your peripheral pain system, that then affects your central pain system and kind of calms that down as well. It is well documented as far as the adult studies. It's referred to as a remote electrical neuromodulation, or REN. If you looked at any of the medical literature, obviously that's a trade name for the device is Nurivio. The way that it activates, it will the information will then ascend to the brainstem and hit the pain regulation centers. It involves several areas. I don't know if you want me to get into the neuropathology of it, but the periaqueductal gray matter, the rostroventral medial medulla, the subnucleus reticulus dorsalis. And so the processing information in the brainstem that releases neuromodulators that can inhibitorily affect this pain that is being modulated through the migraine and ramp it down.
So how often a day could I use this? Say I use it for 45 minutes and then 15 minutes after I stop, I realize it's coming back.
So it's in the studies, they typically the patients did not need to use it again within the 24-hour period that there was that, so in the studies, we did not evaluate them using it within a 24-hour period again, because we wanted to see if the headache went away or if the migraine completely went away. One of the endpoints was, 24-hour pain freedom or pain relief. Pain relief is just going down to a mild to moderate, from severe to moderate to mild to nothing. They did not exactly study repetitively using it over and over again or using it as a preventative. It is not a preventative, it's acute rescue. However, what they showed was that most patients that participated in the study did not need to use it again within 24 hours. But the nice thing about it is that if you did need another rescue, say you did need another rescue, like a medication, you could take it with this. There's no contraindication that would prohibit you from taking an oral medication or an intranasal or an injection medication with this type of therapy as well. So you're not taking like 2 oral medications, 3 oral medications, and an injection medication, this is kind of like a nice start, because from a homeopathic standpoint, you're not taking so many of these meds. A lot of times with migraine, we would make a migraine cocktail and combine things for patients if they have really stubborn migraines. And it's kind of tough because there's layers of how many meds you want to take at one point in time for one migraine, or even if the migraine doesn't go away, and it's kind of hard. So introduce something that is not a pharmacologic agent from a oral pharmacologic or injection standpoint is very nice.
Are there signals that you would recommend parents watch out for to determine whether they ought to speak to a doctor like yourself or to pursue counseling for migraines? So many times when children have issues like this, they're not properly diagnosed, or they may be diagnosed as psychological. And can you tell us what to watch out for?
That's an excellent question. And I get that all the time in my practice. I have patients that have struggled for years and did not think that that they needed to come to somebody regarding the migraine. And again, it was misdiagnosed as sinus, or it was misdiagnosed as anxiety or depression. And when someone's in pain, they behave inappropriately sometimes, if you're in chronic pain or if you're in bad pain. The things, the warning signs, if a person or your child, your adolescent is going into a dark room, needing to pull the shades down, wanting to wear, sunglasses, or not wanting to be on a computer or a device, or after they're on a computer or phone, our kids are on so many devices nowadays with hybrid learning and homeschooling and their phones and whatever. But if they're fatigued and they're getting headaches afterwards, it may not be just not only the time on the device, but it might also be that they're very photosensitive, or the light from the computer or the phone is really triggering them to have issues. A lot of the kids will get car sick very easy. So even adolescents, if they sit in the back seat of the car, my daughter, we went to Florida for vacation, sure enough, backseat of the car, came back into the hotel, threw up in the hallway, and it was the car sickness that triggered the migraine. But listening to them about, I don't feel good. Sometimes adolescents cannot vocalize pain properly. Even adults can't vocalize what the pain feels like properly. So really trying to give them the words to find out. And they're not necessarily being avoidant of things all the time. They may be trying to communicate with you that they don't feel good. The bigger danger too is that I see in interviews a lot of times with my own patients, is that I'll say, well, what do you do when you get a headache? Do you take any over-the-counter medications, ibuprofen, acetaminophen, anything like that? And inevitably the kids will be like, oh yeah, I'm taking that like 3 times a week. And the parent immediately is like, what? When do you take that? Wait, I didn't give that to you. Where do you get it from? And, especially our adolescent population, a lot of them have these medicines that are in the house or they're accessible. And we believe that they're benign because they're over the counter. But if you repetitively take these medications, like if you take an over-the-counter medication more than 3 times a week, you set yourself up for medication overuse headache. So you have now caused yourself headache by overusing something that was not meant to be used that way, and eventually can cause reflux and kidney issues or liver issues, depending upon what the medicine is. So very concerning, especially for our young people, regarding seeking help for things when they don't feel well.
Let me ask you about PTSD, because some of the symptoms you were just referencing sound a little bit like the kind of thing we see in adults with PTSD, going into a dark room, isolation, and undescribed pains that may be psychological, but may also be physical.
Yeah, so there have been some studies that have supported, and I see this in my own clinic, that patients who have had a pre-existing history of post-traumatic stress disorder for whatever reason, have a higher incidence of pain in general, but also migraine. So when we are stressed, and post-traumatic stress has that even in the definition, when we are stressed, this can escalate our sensitivity to the world around us. I always explain to migraine patients, you're now a sensitive person. Welcome to the club. The light bothers you, the sound, the touch, sweaters, taste, everything is just more heightened for you. So what we need to do is calm your universe down. We just need to chill it out a little bit, and your world will feel better for you. Same thing with PTSD. We need to kind of calm down the way that we express our our feelings within our body, and kind of de-escalate those kinds of things to keep it at a different level, so that when that stuff comes into our world, we're able to calm it down even easier. It's not as easy as, I mean, I say this, but it's a very challenging thing. But I always introduce like mindfulness, meditation. The nice thing about the device that we were talking about is that it does keep a diary, and it can tell you, when you had these events, and you can log other things associated with it. I always encourage that for my patients, understanding if there were food sensitivities, if there were things in your life that were very, like, even if you didn't drink enough water, you didn't get enough sleep. A certain job, I can't tell you how many patients I've had that have been in certain job situations. They quit the job and they're like, my headaches are gone. And I'm like, wow, go figure, it's okay to find a different path in your life if that path is very uncomfortable for you.
Hey, Mom, can I drop algebra?
No. Yeah, that's a whole nother topic.
Yeah, so I was wondering about this app. So the app is keeping track, obviously, of the time that it happened,
Yeah.
the frequency that's happening, the duration, and so forth. But it also gives you an opportunity to write a little memo and say what was going on at the time, what you ate, whether you'd gotten enough sleep, etc.
Yes, you can keep track of things in addition to like the date and time that it happened. And so you can look back at this and reflect and feel a little bit more confident about, trying to control those mitigate those factors in your environment that you feel might be causing it, which is huge, because we all, like, I have migraine and I love chocolate cake, but I know if I eat the chocolate cake, I'm going to get the migraine. But I'm going to eat the chocolate cake some of the days because I really want the chocolate cake, but I'm going to have my stuff ready to treat myself because I know I'm going to pay, but sometimes it's worth it.
Right, right. But at least you can begin to identify some of your triggers.
Exactly. I'm in control.
It really sounds like an interesting device.
Right, and it's nice to have something that has been approved for teenagers, because so many medications are more severe on teenagers than they are on adults. And so the medication approach becomes problematic for that reason. And I saw that there's another, I think, Cephaly or something that's been approved for adults, but not for teens.
Right. Yeah. I mean, there's 28% of teens 15 to 19 years old have been diagnosed with migraine. And, kids, when they're little, it's 1-to-1 females and males. But then when you hit puberty, there's a higher incidence, 3-to-1, of females being affected. And what the data has said is that 37% of children say that their schoolwork suffers when they have a headache. So this is a huge impact upon our teenagers and their lives. And as you said, this may be misinterpreted as avoidance or anxiety or other types of issues, when really, they truly have a migraine, and if they were just treated appropriately, this might improve their quality of life dramatically, if they had the proper treatment.
Yeah, and I think you said an important keyword there, that you get some control back over your life, so that when
Exactly.
this is happening, you don't have to just tough it out or leave school. You can actually do something about it, with reasonable accommodations. I assume you'd have to warn the school that your child may need
Yep.
to do this and so forth, right?
Yeah, and they're very accommodating. I can have a patient go to the nurse, put the device on, go back to class. They don't even have to miss class. They can even go to the bathroom, put the device on if they prefer, dependent upon, the school and the patient and the comfort. But a lot of it is awareness of, as you said, the control of your own health, and to have that autonomy in a teenager is ideal, because unfortunately, these teenagers grow up to be adults, and I can't tell you how many times I'm sitting in the room with a teenager, diagnose them with migraine, talk through things, see them back a few times, watch them get better. And then the parents like, hey, can I come see you too? Because I just realized, this is actually what I've had for a long time, but I just never really was diagnosed, and I never really paid attention to it. And then it breaks my heart, because I feel like, this person could have had this improved quality of life for many years, but didn't really have the education to understand. And the other thing is that there's just so much now for migraine and the treatment of migraine that has never been there before. So even if people believe they think they know what's going on, not true anymore. The past 5 years, it's been an explosion in this field as far as ways that we can help people. So I would really encourage people to reach out to their doctor, or even if their doctor is unaware, a specialist, a neurologist, a headache specialist, that can discuss things with them.
So even if they've been through a lot of medical examinations about this 5 or 10 years ago, it's still worth doing it again.
Dramatically different.
The
Yeah.
technology has improved so much.
Yep.
Great.
What about charging this device?
This is fine. You get one a month. And so you have it one a month, and you get a certain number of stims a month. And then you have to get the next one the next month. You would get the stims re-upped the next month for your phone.
Is there some topical medication involved in it as well, or just the stimulation?
Just put it on. Yeah.
Great. Well, thank you very much. This has been very enlightening, and I appreciate your coming to talk with us about this, and we wish you great luck with your own self and your daughters.
Thank you. I appreciate it.
Tell us the name of the device again and maybe spell it.
It's Nerivio, Nerivio.
And the website is nerivio.co, which is a UK thing. It doesn't have an M on it. Nerivio.co. So, and seek out a pediatric neurologist who can assist you with the diagnosis. Is that right? Is there another specialty name that people might look for locally?
Even if someone has headache specialist, and a lot of the adult headache specialists will see teenagers as well. So if you do have a teenager, sometimes they will cross specialize, but pediatric neurologists, obviously most of them are well versed in this, but headache specialists specifically, if you contact the company too, they can link you with somebody that would know about it. And you can look online at the American Headache Society. They have some information and lists about it. And if there's any concerns, I'm at Dent Neurologic. They can look me up on the web at Dent Neurological Institute if there's any concerns.
Wonderful. Thank you very much.
Thank you
very much, Dr. McVige, and thank you, Robin, and thank you, everybody who's been with us today. And we hope that you will be well and be a powerful patient. Bye-bye.